Thank you, Yuan. Ladies and gentlemen, as you've heard from my colleagues, post-traumatic stress disorder is a very real and very serious illness. But I want each and every one of you to know that amidst the tragedies experienced and the challenging symptoms PTSD victims face, that there is light at the end of the tunnel. The first thing you need to understand is that victims of PTSD are not alone. As David stated earlier, men, women, and children from all walks of life experience PTSD from a multitude of tragedies. The next thing you need to understand is that there is help out there for each and every person. And because every person is different and every experience is unique, there are several methods of help and treatment for those experiencing PTSD. These methods include clinical and non-clinical treatment, as well as professional and even self-help treatments. Smith and Segal of helpguide.org provide 4 very helpful types of professional treatment in their article, Post-Traumatic Stress Disorder, Symptoms, Treatment, and Self-Help. These types of treatment are trauma-focused cognitive behavioral therapy, which involves carefully and slowly exposing the individual being treated to thoughts, feelings, and situations that remind them of the trauma, and allowing the individual to overcome irrational thoughts and behaviors, becoming more balanced. Also, family therapy, which is just that. It allows not only the victim, but their family, to open an understanding environment conducive to working through relationship problems created by PTSD. Clinical treatments include medication such as Prozac or Zoloft for anxiety and/or depression. And lastly, EMDR, eye movement desensitization and reprocessing. This is a form of behavioral and stimulation therapy in order to interrupt the brain's information processing system in extreme stress cases. Self-help treatment is also an option and consists of a few different things. One way is to reach out for help. This could be a friend, a family member, a supervisor, a chaplain, a counselor, or a support group. Another way is to avoid depressants, such as drugs and/or alcohol. These tend to mask the symptoms temporarily rather than treat them, and substance abuse can create worse problems later on. The last thing for self-help is to challenge your state of mind. This can be done by reminding yourself of your importance, and one way to reclaim your sense of self-worth is by helping others volunteering. 2 of the most important things to remember about treatment for PTSD are to find the treatment that suits you best. If you or your loved one seeks professional help, verify their credentials, but also ensure the doctor or therapist you choose meets your individual needs. And secondly, don't wait. Although PTSD can be especially wearing on an individual, the quicker PTSD is dealt with, the easier it is to overcome, and the longer you wait, the more damaging it can be. In conclusion, today, Yuan, David, and myself have shared with you some insight on post-traumatic stress disorder, including causes and effects, signs and symptoms, and treatment options. Remember that though PTSD can feel overwhelming and unmanageable at times, that it can be overcome with the right knowledge and the right help. It has been our distinct privilege to shed some light on a very dark topic. Thank you for your time.